So at this point, my patient dressing has been removed. A sterile 4x4 gauze has been placed over the insertion site. I am ready now to set up my sterile field. Wash my hands. Make sure that my table is clean. My kit is available. The difference in the supplies that you're going to need depending on the skill that you're going to perform. If you're going to be doing a dressing change, you're going to need your bio patch. If you're going to do a CVC removal, you're going to need a 2x2 gauze and a suture removal kit, which we will supply. And then you'll bring your CVC dressing kit. I already have my mask on because I already removed the old dressing from my patient. So now I'm just ready to proceed. I'm going to open up my bio patch. Open up my sterile 2x2 gauze. If I am going to remove the old dressing. And open up my suture removal kit. First thing here is the mask. I'll go ahead and remove that. Second thing is the gloves. I'm gonna go ahead and put that off to the side. I'm gonna reach in and grab my drape. Step back so as not to contaminate my drape. Using the 1-inch border to set up my sterile field. Shiny side down. Now I'm going to put on my sterile gloves. It's a good opportunity right before you put on your sterile gloves to make sure that everything else is set up. I've opened up everything. Apply my sterile gloves. Now I'm going to put everything that's in my kit onto my sterile field. My dressing. My iodine swabs, put second. My alcohol swabs I'm going to put first. And at this point, I'm going to make sure that I'm using centimeters. I make sure that we measure the catheter insertion site in centimeters, folded the line at the 0, and scrunched it up just to make sure that when I place it into my sterile field, it's not going to fling all over the place. My 4x4 gauze, I'm going to fold it into a 2x2 gauze, place it there. And then I'm going to ask somebody to help me put on the bio patch onto my sterile field. There it is. So it's on the sterile field. And now you're ready to proceed to cleansing the site, or the insertion site of the CVC, and then you're all set up. Now that we've set up our supplies, we're ready to come back to our patient to continue the process of cleaning the site and either removing the CVC or reapplying a new dressing. Okay, Ms. Jones, I'm going to go ahead and still continue to ask that you have your head turned to the side, and I'm going to remove the sterile 4x4 gauze. I have sterile gloves, so I'm going to touch it from the middle, and I'm going to discard it. I have my alcohol swab sticks that I'm going to use to clean first. The way that you clean it is you start from the middle, create some good friction. Remember that these are going to be sutured down, and you're going to go in a circle, making sure to cover the entire area that the tegaderm would cover. Now in this video, I'm being careful not to move the central line too much because it's not sutured down. But in real life, you want to make sure that you clean the central line as best as possible. Now you never want to clean from the outside and bring whatever's on the outside towards the middle. You always want to go from the outside in. Once we've done 3 swabs of the alcohol, we're ready to now proceed to the betadine. Now, Ms. Jones, just to be clear, you're not allergic to betadine?
No, ma'am, I'm not.
Okay. If they were allergic to betadine, we would use chlorhexidine or whatever your hospital policies and procedures would say for you to use. Make sure to get the entire area. We're taking this opportunity to really assess the site, make sure that there's no discharge, no tenderness or pain. It's kind of hard not to move that CVC line that's not attached. In each instance, after you've applied the alcohol and you've applied the betadine, you want to let it dry. Of course, these are mannequins, not real patient skin, so they're not going to dry quickly. So we'll go ahead and then proceed to measuring the CVC insertion site. You want to measure at the insertion site to the hub right here. And that looks to be about 3.75 centimeters. If we're doing a removal, which we are, we're going to need to keep our measuring tape, place it off to the side, because we're going to, once we remove the central line, we're going to measure the entire length of the catheter to make sure that it hasn't broken or there's missing pieces inside the left inside the patient's body. So we're going to lay that off to the side. Now at this point, we would ask the patient to keep their head turned, we're going to go ahead and remove the sutures. Remember, these would be sutured in. What's important here is that we stabilize the catheter. So we'd pull up on the suture. We'd get underneath the suture, cut, stabilize, pull. The other side, oops, we would pull, cut, and stabilize. Once we've done that, we're going to put this in our biohazard bag. Okay. Get our 4x4 gauze that we folded up. Now at this time, Ms. Jones, I'm going to ask that you hold your breath on the count of 3. And then students, in one swift, continuous, smooth motion, you're going to pull the catheter line out. If you meet any resistance, you're going to make sure that you don't tug on it. You just leave it in place. You call the physician for assistance. Okay, Ms. Jones, on the count of 3, please hold your breath. 1, 2, 3. Apply pressure. At this point, you would make sure that that catheter tip is intact. Make sure that there's no fragments missing. Everything looks good. Ms. Jones, you can go ahead and continue breathing. Of course, you would ask the patient to breathe right after you would pull this out. I was just making sure that I told you about the edge of the tip of the catheter to make sure that you assess that. And you're going to then measure this before you discard of it. Measure the entire length of the catheter just to make sure that it's still intact. Put that in your biohazard bag. You're going to apply firm pressure for at least 5 to 10 minutes. Longer if they are on antithrombolytics or anything that helps them prevent clotting. After they've done their stopped bleeding, you can go ahead and look. They've stopped bleeding. Then you're going to get your sterile 2x2 gauze that you already opened. Take that off, apply it, then get your Tegaderm. Place it on your patient. Make sure that it's nice and snug. At this point, you can take off your gloves. Put it on your patient. And then we'll talk about education. After that, you can go ahead and reapply your gloves. Of course, reposition your patient for comfort, educate your patient, which we'll just talk about, and make sure to measure your entire catheter CVC line. At this point, we're going to do the dressing change. We've already cleansed the site with alcohol swab, allowed it to dry. We've cleansed it with betadine, allowed it to dry. And now we've measured it already. So we've already verified with what's already been documented that it was sutured at. And now we're ready to apply the biopatch. Now the biopatch is a bacteriostatic patch that is applied around the catheter insertion site to prevent any growth of microorganisms. It does have a slit. In order to allow for easy removal and cocoing it the second time around when you're doing the dressing change or the removal, it's best if you apply the slit towards the CVC hub on this side, so that when you go to remove it and you're removing the tegaderm or the occlusive dressing, when you pull it off, it will lift up on these flaps of the biopatch. Once you apply the biopatch, then you want to apply the occlusive clear dressing. Making sure that you get a good firm seal around the insertion site and then around the rest of the catheter site. So once I've removed the surrounding paper around the tegaderm, I'm going to initial it, date, and time it. I can now tell my patient that she can turn to where it's a comfortable position for her. She doesn't need to turn to her left. The other thing is that I want to get my tape, making sure that my patient's not allergic to the tape. And I want to secure the 3 lumens of the catheter as such, so that if these were to get tugged in any way, they would get pulled on the tape here and not on the actual insertion site or where it's sutured in. Return your patient to a comfortable position. Make sure that you ensure safety. Clean your hands, and you are done. So now that we finished performing all 3 procedures for the central venous catheter demonstration, we're talking about documentation and what's important to educate our patient about and what we're going to document in our nurse's notes or in the patient's chart. One of the things that we want to document is the procedure, what it is that we did with the patient and for the patient. Second thing that we want to document is our assessment of the patient. What did you see? What did you smell? What did you feel when you palpated the site, when you assessed the site, both before you took off the dressing and then after, if you did a dressing change or removal. The other thing that you want to document is the patient's response. Did the patient have any pain or report any tenderness throughout the procedure? You want to make sure that you document the measurement. Remember, after you cleanse the site, you measure the catheter insertion site to the hub to make sure that it hasn't migrated. You want to make sure that it hasn't migrated, because if it has gone out and in, then there's that increased chance for infection. You want to make sure that once you've removed the catheter, you measure the entire catheter length to make sure that no piece of the catheter has been retained into the patient's body, inside the patient's body. You also want to document the education provided. For the removal, you want to make sure that you definitely educate the patient, because once you removed that central venous catheter, most of the time they're going to be transferred from your unit to maybe a step-down unit or go home altogether. So at that point, you want to make sure that you educate them to come back if there's increased bleeding or any signs and symptoms of infection. So you want to go specifically into what the signs and symptoms of infection are. You also want to educate them to not do any heavy lifting. Anything above a gallon of milk, they don't want to lift, because that's going to put too much pressure on the insertion site, maybe cause bleeding. You want to encourage them to keep that site clean and intact. So if they're going to take a shower, make sure to cover it or not get it too wet, because you want to make sure that that occlusive dressing stays intact, stays dry, for nothing to go inside the dressing and get soaking wet or increase infection. The last thing you want to document is your education. And if the patient had any questions, you want to document what your response was to that patient, and that the patient verbalized understanding and knows when to come back or knows when to report something to the physician or to the nurse. Thank you, and congratulations for finishing the video.